Ever heard of RSV? It stands for Respiratory Syncytial Virus. And while it might sound like a mouthful, it's something you should definitely know about. It's more than just a pesky cold. RSV is a highly contagious virus that affects the respiratory tract. It's especially common in the fall and winter months, much like the flu. Respiratory syncytial virus, or RSV, is a common bug that usually just causes mild symptoms like a runny nose or cough. But did you know it can also lead to more severe respiratory issues, especially in certain groups of people? For most people, RSV is just a nuisance. However, for others, it can get pretty serious. Let's break it down. RSV can lead to bronchiolitis, which is an inflammation of the small airways in the lung, and pneumonia, which is an infection of the lungs. If you're over 60, have a weak immune system, or deal with chronic heart or lung disease, you're in the higher risk group for severe RSV. This means that what starts as a simple cold can quickly escalate into something much more dangerous. Think wheezing, shortness of breath, and even respiratory distress. These symptoms can be particularly alarming and may require medical attention. In severe cases, hospitalization might be necessary to provide oxygen therapy or even mechanical ventilation. Diagnosing RSV usually isn't necessary because it often goes away on its own. Most people recover in a week or two with plenty of rest and fluids. However, for those at higher risk, early diagnosis can be crucial. If needed, doctors can use RT-PCR tests for a pretty accurate diagnosis. This test involves taking a swab from the nose or throat and can detect the presence of RSV with high accuracy. Treatment mostly involves supportive care, rest, hydration, and keeping that fever in check. Over-the-counter medications can help alleviate symptoms like fever and pain, but always consult with a healthcare provider before taking any medication. In more severe cases, doctors might use bronchodilators or corticosteroids. These medications can help open up the airways and reduce inflammation, making it easier to breathe. Ribavirin is another option, though it's a bit controversial. This antiviral medication can be used in severe cases, but its effectiveness is still a topic of debate among medical professionals. Prevention? Good news. The FDA has approved RSV vaccines like Arexvy and Abrysvo for adults 60 and up, and even for pregnant people to protect their newborns. These vaccines have shown promise in reducing the severity of RSV infections. A single dose is recommended for those 75 and older, or at-risk folks aged 60 to 74. This can provide a significant level of protection and peace of mind, especially during the peak RSV season. To wrap it up, RSV might seem like just another cold, but it can be much more serious for some. Awareness and prevention are key. Knowing the symptoms and risk factors can help you take the necessary steps to protect yourself and your loved ones. Stay informed, protect yourself, and talk to your doctor if you're at risk. Early intervention can make a significant difference in the outcome of an RSV infection. Subscribe for more health insights on Bedside Chronicles. We're here to keep you informed and healthy.